Welcome back to Power in Politics. Canada's cities and its hospitals are certainly on the front lines of the COVID-19 pandemic. Doctors and nurses are working around the clock to save those infected with the virus, and city officials are watching the numbers, doing what they can to stop the virus from spreading. Physically and emotionally, it's a lot to take on, but one family is leaning on each other to get them through to the other side. John Tory is the mayor of Toronto, and his daughter Susan Tory is an internal medicine doctor at Toronto's Humber River Hospital. They both join me from where else but that city. Hi, nice to see you both.
Hi.
Nice to see you.
Dr. Tory, I'm going to start with you. First of all, thanks for the work that you are doing on the front lines. How is it? How has it been? What has it been like?
It's variable. We enjoyed a slower period when we were really worried about experiencing the type of surge that we've seen in places like New York and Italy that would overwhelm the hospitals. But we were very fortunate to have a luxury of room at the hospital. But of course, now with the developing situation in the long-term care homes, it's very challenging for all the hospitals in the GTA and I'm sure provincially to try and help offload the burden of illness that they're seeing at the long-term care. So it was quiet, but the patients were very sick, so kind of quiet but busy.
And are you seeing basically more capacity used up now because of the issue in long-term care homes?
Absolutely, yes. We're seeing now, not only just from that factor alone, but because we're starting to see a lot more of the regular traffic that would come into the emergency department that we hadn't been seeing for a period. They're starting to reemerge now. A lot of non-COVID related reasons to coming to hospital, they're starting to come back now. So capacity is definitely becoming a day-to-day issue that we have to follow really closely.
Mayor Tory, we've spoken to you often on the show over the last 8 weeks about this pandemic and your response as mayor and your city's response to it. How have conversations with your daughter informed, I guess, your thinking around things or sort of the decisions that you end up making?
Well, it's humanized it, frankly. You know, when you're a politician, the only risk that you end up taking is the risk of becoming unpopular or the risk maybe of being defeated in your job. But I have a daughter and many other people have daughters and sons who are on the front line of this. And, it's not just caring for people. It's not just seeing firsthand, what's going on with people actually being very sick and losing their lives, but it's the caring that's being provided for. I saw a picture of my daughter on television holding the hand of somebody that she was trying to look after. And I sort of realized that for all that we do, sitting in our offices trying to make the right decisions to provide support to them, that those are the people working in the shelters and the people working in the hospitals and the people that are on the true front lines. Politicians really aren't. We're on the front firing line. I'm supposed to be accountable, which is quite proper. So it is very helpful because I get that kind of front line, firsthand, no filter feedback from Susan about what's going on. And it's been very helpful for me to know those things. She doesn't tell me any secrets. I'm sure that she's not supposed to, but I just find out things that otherwise you don't get out of reading reports or sitting in meetings.
Dr. Tory, how has it, I understand all the logistics that you told us about what it's like on the front lines, but what is it like, we're so lucky on this show to benefit from the expertise of so many doctors who carve out time for us. And I always wonder, it must be difficult to sort of witness this up close, witness what your dad describes up close. How has it been?
It's very difficult, and it's operating and doing your job in a reality that's so foreign to what anyone could have imagined before. And I think everyone just tries to continue to show up and do that job to the best of their abilities. But it's a very weird way to practice medicine and to treat patients in complete isolation from their families. They don't have the luxury of having family there for emotional support. And the severity of illness is very drastic at times. And so you can see things escalate very rapidly from a clinical standpoint where a foreseeably young and healthy person comes in with respiratory complaints, and then less than 12 hours later, they can find themselves on life support in the ICU. So it's scary, and you're worried about your patients, you're worried about yourself, you're worried about your family and not bringing, things home with you and endangering the lives of your community and the people around you that you love.
Mayor Tory, I can only imagine how worried my dad would be. Do you worry about your daughter being on the front lines of this?
Every day. because, and look, I'm very proud of her. I mean, how could you not be a proud father or proud mother of a daughter or son who ends up on the front lines and providing that kind of caring? And I know she's providing her care not just with professionalism, but with compassion. But, this is the other thing I don't think we focus on. Again, as I said at the beginning, I'm not in too much risk going to my office at City Hall and doing my job, as challenging as it may be. My health is not at risk, and I'm not even exposed to the realities of what Susan just described in terms of people who are suffering. And I saw it for the first time, probably myself, when she was on television with people one of whom on television just the other day died. She was telling that story. And I mean, I'm thinking to myself, my God, thank God all these people across the country are doing this. But I do worry about her because, mind you, I worry. I have a son who was a pilot at one stage, and I would say when it was raining and there was the slightest cloud in the sky, he shouldn't fly. And he'd say, Dad, I'm trained to do this. And so she's trained to do it. But nonetheless, you're worried about your children, but I'm proud of her at the same time. So I guess that's the way it is. I would be inhuman if I wasn't worried.
You wouldn't be a parent. That's what dads do. They worry all the time. I can tell. Yeah, I can tell you from my own experience with my own dad. Dr. Tory, there's a lot of conversation, obviously, about what's happening at the moment, but there are also conversations about sort of what the bigger lessons in this are for us, especially where the healthcare system is concerned, and especially where long-term care is concerned. Based on your own experience, what are your thoughts on that?
I think that, one of the things that makes me feel secure in doing my job, and I'm sure all the other frontliners doing their jobs as well, is to feel that I'm protected. So I'm able to do my job in a capable manner and continue to do it without the fear of falling ill. And so I think one of the hottest topics of this whole pandemic has been the availability of PPE and making sure that I have the proper protective equipment to make sure that I won't contaminate myself, contaminate other patients, contaminate my family and other people that I am in close contact with. So I think, that's become a lesson for us all, just like we learned a lot of hard lessons when we had the SARS, situation in Toronto. And unfortunately, you learn a lot more lessons the hard way in knowing the importance of factors like PPE and planning effectively.
Yeah, you sure do. I'm sure we'll be talking about that for many weeks and months to come. I really thank both of you for making time for us tonight. It was a real pleasure to have you on together. Thanks to Mayor John Tory and Dr. Susan Tory.
It's the closest we get these days, but thank you.
Yeah,
very much.
I bet.
Right. Thanks for having us on.
Thanks very much to both of you. Really appreciate it. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.